Welcome to our Community Resource Night. My name is Sophia. I am the Youth and Family Programs Manager at NAMI Santa Cruz County, and I really hope that these meetings can be a useful tool to you as parents and caregivers and leaders of the community to learn more about what resources are available and how to access them. And I also hope that if you haven't already, you consider joining one of our NAMI family support groups for parents of youth and young adults. And we have that information on our website at namiscc.org. I am really glad to have Amethyst Darty here tonight. She is a nationally certified school psychologist, case manager, and counselor who provides mental health services to students in Santa Cruz County. And tonight she is going to be presenting on alternative education programs, such as IEPs and 504 plans, which are available to students with mental health disabilities. Amethyst, thank you so much for being here.
No problem. It's my pleasure. I chose this theme because I thought we would spring into IEPs, 504s, and alternative education. All right. So, about me, I am a school psychologist and I currently work for the Santa Cruz County Office of Education. I was trained in Oregon up in Portland, and I'm triply certified in the state of Oregon, in the state of California, and as well as a nationally certified school psychologist. I had previous experience as a special education teacher for 6th and 7th graders, as well as a 504 coordinator and reading interventionist. And finally, I have ADHD myself, and am an advocate for others who are neurodiverse. We will be headed into IEPs and special education first, then we'll cover 504 plans, alternative education, and finally, I'll allow some time for questions at the end. All right, IEPs and special education. What is special education? It's important to remember that special education is not a place, but rather a service or a pool of services. And schools within the US are obligated to find all children who have disabilities and may receive special education services. This obligation is legally known as child find. Schools have to evaluate any child that is known or suspected of having a disability. And this is defined within our legal system through federal and state laws. At the federal level, you have the IDEA Act, the Individuals with Disabilities in Education Act. And at the California state level, we're guided by the California Education Code, as well as the Code of Regulations. Special education services are documented within the IEP, which stands for Individualized Education Plan. And this ensures that students receive a free and appropriate public education, also known as FAPE. There's going to be a lot of acronyms, but I will use them multiple times. Special education services often include specialized academic instruction at pre-academic ages in the preschool. It will be noted just as specialized instruction. It can also include ERMs, which are educationally related mental health services, and that's some of what I provide to students on my counseling caseload. Special education services could also look like occupational therapy, speech therapy, physical therapy, one-to-one aids, or vocational skills development. Who is eligible for special education services? So students who are between the ages of 3 and 22, which we refer to as school-aged, and those students must have 3 things. They must demonstrate the presence of a disability within one of our 12 eligibility categories within California. They also need to have an adverse educational impact stemming from that disability. And finally, they need special education services in order to access a free and appropriate public education, FAPE. Now, you might be wondering, I have a child, they are under 3. I think they would qualify for special education services. What about me? So because students who are under 3 are not considered school-aged, they're still eligible for disability-related supports, but they don't yet enter the special education services. Instead, they receive early start services, which is also something that the County Office of Ed supplies. So students who are eligible for SPED services demonstrate the presence of a disability. They've got that adverse educational impact stemming from the disability. And we know that they need special education services in order to access FAPE. How do we know? How do we know that they demonstrate this and that they have adverse impact and that they have a disability in the first place? Well, we learn this through the eligibility process, where we conduct a comprehensive evaluation to answer those questions. The process in order goes something like this. The student is first referred by a parent, teacher, or other school personnel. And then an assessment plan is developed, which is communicated to the parent. And that assessment plan is used to guide the evaluation and should include all areas of suspected disabilities. Note that it is suspected, not confirmed. The evaluation process then confirms eligibility, but the law requires us to evaluate in all areas that we suspect a disability to occur. Once that assessment plan gets signed by the parent, then your school teams have 60 calendar, not school days, 60 calendar days to conduct the assessments that were on that plan, to document their findings within an evaluation report, and to hold the initial eligibility meeting with the IEP team. And the eligibility criteria are category specific. Again, the student's disability, if deemed eligible, will be placed into one of 12 categories, and those are defined by California state laws. At the initial eligibility and IEP meeting, which includes parents and the school team, that team will establish eligibility and form the IEP as a team. And that IEP also includes a determination of the student's placement in what's called the least restrictive environment. Least restrictive environment simply refers to the least restrictive on the continuum of placements from I'm at my home school receiving some in-class support to home hospital, non-public school, I'm in a specialized classroom, and all the placements in between. So least restrictive environment is determining which placement is least restrictive for the student to be able to access their education and receive educational benefit. After that IEP is formed at the meeting, it's time to be signed and then implemented. IEPs are reviewed on an annual basis at minimum, though parents have the right to request an IEP meeting at any point in time. This process is done all over again every 3 years because it is legally mandated. For students who receive special education services, they must be reevaluated triennially. All right, we've got 504 plans. Oh, just kidding. We missed a slide. What's included in the IEP? So IEPs contain the actions that promote the special education students' access to a free and appropriate public education. How do they do that? Well, they're specific to the students' identified needs, and those identified needs come from that evaluation report, which says this is the category of eligibility that they meet, and these are the needs that our assessments have identified. The IEP also includes basic demographic information, which specific eligibility categories the student qualifies under, and timeline information like when is the next annual IEP and when will the next reevaluation be due. IEPs also contain present levels and IEP goals, and those goals address the students' identified areas of need, again, which come from that special education evaluation report. IEPs also contain services, and those services detail the methods of special education. What does special education look like for that student? The IEP also contains special factors. This could be applicable if you have a hearing impairment, visual impairment, deaf blindness, or orthopedic impairment. Also contained within it are accommodations and modifications, as well as statewide assessments and any accommodations that follow those. And finally, the special education placement. Now, this special education placement, when I refer to least restrictive environment, that's what we're considering when we're considering placement at IEP team meetings. We're looking for the least restrictive setting for students to access and benefit their education. So the least restrictive of those would be the student attending their homeschool general education classroom with or without related services. Those related services are things like speech, OT, PT, counseling. Higher up on the continuum would be a specially designed classroom at their home school or a specially designed classroom in a regional program. So those are self-contained classrooms where the students spend the majority of their day typically within that special education setting, and then go out to the general education environment for mainstreaming. Another placement option on the continuum is a non-public school, and home hospital instruction is also an option when we're considering special education placements. All right, and at the bottom, the most important part of the IEP is parent input. So parent input is actually one of the first things that appears on an IEP team. And as a parent, you are well within your rights to disagree with the IEP team. And any disagreement that you have, or simply questions or concerns, will be documented within the IEP under the parent input section. IEP meetings also contain meeting notes where there's more of an informal record of how the discussion and conversation went throughout the meeting.
I have a question, Amethyst.
Absolutely.
Are providers like psychiatrists, psychologists, or primary care doctors who have a history with the student involved in the IEP referrals or plan input at all?
Yeah, so part of the IEP team is the school nurse. And so the school nurse will often collaborate with parents and with healthcare professionals to gain an idea of the student's developmental history as well as their current health needs. So that information is included within the evaluation report, and any health-specific needs to the child are also included within the IEP.
Thank you.
For sure. All right, next up is 504 plans for real. Who is eligible for a 504 plan? So 504 plans, although they are related to disability, they are distinct from special education services. Students who require accommodations to gain access and educational benefit are eligible for 504 plans. But these students do not demonstrate a need for specialized instruction or modifications to the curriculum. Examples of accommodations might be extended time or preferred seating. Some examples of specialized instruction may be adaptive skill building on teeth brushing skills, or modifying the general curriculum to meet the student who is nonverbal. So 504 plans are capturing students who don't quite demonstrate the level of specialized instruction and need that those who qualify for special education services do. A 504 plan eligibility is not based upon those categories like a special education evaluation would be. Students who are found eligible for 504 plans have a physical or mental impairment which substantially limits one or more major life activities. And this is straight from the law. If you're feeling like it's a little vague, you're correct. Some examples of major life activities are walking, talking, eating, sleeping. Those students must also have a record of the impairment, or they're regarded as having such impairment. This becomes relevant when you're looking at proof of a learning disability. it's not necessary for a 504 plan to have an official diagnosis, but it can be. So you could have medical documentation, or you can have other documentation that proves the student has been regarded as having that impairment. Some 504 plan impairments that I've seen in my time are ADHD, dyslexia, sleep disorders, depression, anxiety, diabetes, and even broken limbs. All right, digging more into what's inside of the 504 plan. The 504 plan contains accommodations. It will specify the impairment and the area of impact, as well as demographic and timeline information. So this 504 plan is taken from the LA Unified School District. And as you can see, the top is demographic information, their projected reevaluation date. And note that this reevaluation date listed on a 504 plan is not referring to a special education evaluation, but rather it's referring to the annual evaluation of the 504 plan itself. The specified impairment is below that, and then the areas of impact, related accommodations, and the details for actuating those accommodations. All right, alternative education. So the state of California has designated the goal of alternative education is to provide different means of achieving grade level standards and meeting students' needs. Through this, students work towards the completion of a high school diploma. And some alternative schools start at lower ages than high school, but all of the COE high school programs, that is the goal. They are working towards that high school diploma. Alternative education schools often have small class sizes, and they may use a variety of instructional styles, including community-based instruction, independent study, or focused or thematic education. These schools meet the same standards for curriculum, instruction, and student performance as do traditional schools. And many alternative schools are also structured to support specific populations of students who may not be equipped to succeed in traditional schools. These populations include students who have been suspended or expelled from district schools, pregnant and parenting youth, recovered dropouts, foster youth, homeless and transient youth, as well as those who are habitually truant, credit deficient, have a gap in their school enrollment, have been retained, are wards of the court, and more. Enrollment in an alternative school is voluntary, and I'll have resources at the end of this presentation for who to contact within Santa Cruz County to ask more about alternative schools. All right, and these are some examples of alternative schools and the ways that their instruction and models are, sorry, spotted a typo, are tailored for their student populations. First, we have the camp, which is a school with inpatient drug and alcohol treatment centers. Independent studies, which is providing learners with self-directed opportunities to complete about 20 hours worth of homework every week, and then have that teacher support through individualized learning plans. The DeWitt Anderson School is a school specifically for young women ages 12 to 18-year-olds. Escuela Quetzal is a high school that has group and individual school counseling services woven in to core academic classes. The Robert Hartman School addresses youth with significant trauma histories, and STAR PLC is a hybrid model where students have some independent studies work as well as participate in a day program. And all of these listed are actually operated by the County Office of Education.
Can you give a little, if you are able to, information on any financial support or that side of these kind of inpatient therapeutic boarding school style options?
Yeah, so the law stipulates that alternative schools are funded proportional to traditional schools, but I'm not sure about the parents of youth enrolled in terms of their financial responsibility. But I know who is, and that would be
Awesome.
John Rice. Yes.
Thank you.
So I can include his contact information in a follow-up.
That would be great.
Of course. All right. And what of these many topics does the Santa Cruz COE do? Well, they provide early start services from birth to 3. So those are those students before school aged that may have disability related support needs. We also host regional special education programs, which include the extensive support needs, specially designed classrooms. Those were previously known as severely handicapped, but ESN students typically have areas of need in all their areas of development. So adaptive, cognitive, academics, and sometimes medical. Another program the COE runs is the MAC Model Autism Program. So that's our Chrysalis Autism Center. It is also a collection of specially designed classrooms. And then finally, our post-senior program at Cabrillo College. Another thing the Santa Cruz COE does is operate the SELPA. The SELPA is the Special Education Local Plan Area. And our SELPA provides local control and accountability to a group of school districts within North County and charter schools in purveying their special education services. The COE also has alternative education sites spread out over 24 schools within North and South County. The Santa Cruz COE also operates teacher support, community events, and homeless youth and families, also known as McKinney-Vento services, and much, much more. All right, I hope this Ghostbusters joke lands okay. So if you're needing to learn more about alternative education, here are the phone numbers for enrollment for North County and for South County programs. If you're considering a special education referral for your child, please contact your child's teacher, administrator, or school psychologist and let them know that you wish your child to be referred for a special education evaluation. If you're considering obtaining a 504 plan for your child, contact your child's teacher, school counselor, or 504 plan coordinator to get that set up. Sometimes with 504 plans, school personnel may hold multiple hats. So your school counselor could actually turn out to be your 504 plan coordinator. All right, I hope that this was informative and just a tad fun. I have so enjoyed telling you about IEPs, 504s, and alternative education. Thanks for listening. Any questions?
Yeah, I have a question. What would you say is the average, I'm sure it differs person to person, but what's like the average timeline from referral to implementation of an IEP?
Yeah, that's a great question. So I'm gonna dizzyingly backtrack to my process slide. There we go. All right, so from referral, there's a specific legal timeline for each of these steps. But if things are sent and signed and sent and signed, assuming it's the same day-ish, you're looking at about 85 days start to finish. And that's from referral to IEP plan meeting. There are individual timelines for each of the steps in the process. And because parents have time to review the documents before signing, sometimes the process can be elongated.
Thank you.
No worries. Great question.
I have a question.
Yes.
How easy is it to get into the alternative schools? Is that something that there's like a wait list, or, if your child needs it, easy access, or?
Yeah, that's a great question. I think that sometimes it is based upon the alternative school itself. Um, Specific schools may fill up as their population is growing, whereas other schools may have availability throughout the school year. It would depend highly on the specific alternative school that you're seeking to enroll in.
Thank you. And then also for children under 3, who should parents contact in that
Yeah,
case?
that's a great question. So, your pediatrician will have information for early start services, as well as the San Andreas Regional Center, um, as well as the COE's early start. So I can pop those folks' contact information in the follow up.
Perfect. Well, I don't have any other questions. I want to thank you again, Amethyst, for sharing this really important information. It was a lot, but you spoke in a way that was really easy to understand. You went through all the points and really appreciated that. And I know that our community will appreciate this insight without, going in blind to an IEP process, which I'm sure can be confusing for folks. So people like you who are willing to talk about it to these groups, we really appreciate you. So thank you so much.
Of course, it's my pleasure. Thank you for hosting.